Excellencies, distinguished panelists and guests, I thank the Human Rights Council for inviting UNFPA to join this vital conversation. I ask the Council to vigorously uphold women's sexual and reproductive health and rights during the COVID-19 pandemic. I especially emphasize the need to address the alarming increase in levels of gender-based violence and even femicide. The situation is urgent. It affects every country. Women are telling UNFPA that domestic violence took a turn for the worse with COVID-19. Due to movement restrictions and lockdowns, women can remain trapped with abusers, cut off from support. United Nations Secretary General Antonio Guterres is calling for peace in the home, a global ceasefire on gender-based violence, which is a pandemic within the pandemic. Thus far, 146 member states have pledged to make peace in the home a reality. We at UNFPA stand with you and appeal to all to join the pledge. Now, imagine a pregnant woman who is experiencing a difficult labor at home with the nearest health clinic several hours away and public transportation suspended due to COVID. This is what happened to Carmen, a young indigenous woman from Central America, who after 2 days of excruciating, life-threatening labor pains, had to make do with an ambulance that was nothing more than a hammock held aloft by community members. In the end, Carmen safely delivered a healthy baby boy. But many pregnant women are not so lucky. Fear of contracting COVID or less money in the household may lead women to delay or even forego prenatal care. Their midwife may be redeployed to fight the COVID-19 pandemic. And midwives risk daily exposure to the virus in close, intimate settings. Many go without the right protective equipment, some having to use raincoats while assisting births. Women do account for around 70% of the global health workforce, yet their gender-specific needs on the COVID front lines are not being sufficiently met. UNFPA is providing personal protective equipment to midwives, and we're providing family planning and dignity kits with soap and menstruation items for women and adolescent girls in refugee and IDP camps. COVID-19 affects everyone, but not everyone equally. UNFPA projects the pandemic could result in millions more cases of gender-based violence. With disruption in family planning, we could also see millions more unintended pregnancies. And already we see setbacks with girls no longer in school and therefore vulnerable to being married off or mutilated against their will. We do not have to let this happen. Sexual and reproductive health services must be part and parcel of essential COVID-19 response plans, with safeguards for safe, quality maternal health care, for delivering remote services through hotlines, telemedicine, mobile clinics, and social media, maintaining global supply chains for contraceptives, and ensuring dignity and respect for all women and girls, including men using their power to help women and girls protect themselves from violence and harmful practices. We are asking who is being left behind and why. UNFPA with partners are researching the unique vulnerabilities faced by older women living in isolation. We're investigating the situation of indigenous and Afrodescendiente women and girls who are affected by systemic racism and denial of quality, respectful care. Whether married or unmarried, young women and adolescents face legal and cultural barriers to information and services that they need to plan their future. Quality population data is key. Data renders vulnerable people visible. Disaggregated data allows governments to plan and prioritize service provision. It empowers people to exercise their rights. Through our work with national statistical agencies, UNFPA helps countries to map populations vulnerable to COVID-19 and to target those most at risk. I invite you to visit UNFPA's innovative online World Population Data Dashboard. It makes it possible for anyone to map local districts by age, gender, proximity to services, and other parameters. As our global community comes together to conquer COVID-19, let us also work in solidarity together, women and men, girls and boys, everyone, to put peace in the home and to defend rights and choices for women and girls. In so doing, we lay the foundation for a more equal, healthy, happy, and prosperous future for all. Thank you. Muchas gracias.